Hello everyone. Good evening everybody. I'm Shreya Varshini from the Resonance Show YouTube channel. I hope you're all doing well and staying healthy at the same time too. Today we're going to talk about a very common yet often ignored problem, allergies and how they disturb our sleeping and breathing. Many people complain of blocked nose at night, constant sneezing, mouth breathing, snoring or waking up tired after a full night's sleep. सम इवन से रात को सांस लेने में दिक्कत होती है और नींद पूरी ही नहीं होती. What many don't realize is that allergies can be a major hidden reason behind poor sleep quality and breathing issues, especially at night. If left untreated, these problems can affect your energy levels, concentration, immunity, and overall quality of life. So, today's session is all about understanding how allergies impact our breathing, why they worsen at night, and what we can do to sleep better and breathe freely. To help us understand this important topic, we have a very experienced expert with us today. Please welcome Dr. Gaurav Agarwal. Welcome, sir. He is a renowned specialist joining us live today. Dr. Gaurav Agarwal is an MBBS, MS ENT, DNB, MNAMS, DAA CMC Vellore, consultant ENT, and head neck surgeon and allergist. Dr. Gaurav Agarwal has vast experience in diagnosing and treating allergy related conditions, breathing problems, and sleep disturbances. His practical approach and patient friendly explanations have helped many people manage allergies effectively and improve their quality of life. And he also handles sessions at national level relating to advice on allergies. Doctor, thank you so much for taking your time away and joining us today.
Thank
Would
you,
you like to?
Shreya, for the elaborate introduction. Thank you.
Yes, sir. So, our topic for today's discussion is how allergies affect sleep and breathing. So, over to you, doctor. Would you like to please go ahead and introduce us to all of this?
Thank you, Shreya. So, I must congratulate you and your team that you have taken such a common but yet unexplored topic that allergies do affect sleep and they lead to disturbances a lot. And this is a very less understood thing, and people usually ignore this कि थोड़ा सर्दी है, कभी नाक बंद रहता है इसलिए नींद नहीं हुई है. But ultimately, eventually, if we think it over a period of 5 years or so, then it may lead to many more problems and may lead to even cognition impairment also.
True, doctor.
So, yeah,
So, are we good to go ahead with the questions that we have planned for the day, doctor?
yeah, sure. Let's go ahead.
Sure. So, the first thing that we have today is what exactly is an allergy?
Okay, so allergy is a thing that there are some things which are usually harmless, but because your body's immune system is not accepting it, and your immune system proactively fights against it and leads to such symptoms like sneezes, like nasal congestion, maybe in the form of cough or what we call it as घरघराहट होती है छाती में. So these are the immune system responses labeled as allergies. So
Okay.
normally they are harmless substances.
Okay. So, is it that they are increasing only due to the cold weather, doctor, or is it usually there?
Okay, so this is a very big myth that they are only in the cold weather. But yes, cold air increases the allergies. Why? Because in ठंडी के मौसम में in cold, we usually prefer to stay indoors, and there are many allergens which are only found indoors. So we are actually being exposed to more of those indoor allergens, and we say that it is not only because of cold; it is because they are staying indoors. Then allergy, this cold air, they makes the airways, the nasal airways, the nasal passages, the throat, and the chest part. It makes it more sensitive. Then the cold reduces the body immunity, and the immune cycle is disturbed. It dries out the nasal passages and the throat. And because of that dryness, also sometimes we feel that stuffiness in the nose or some hawking cough. So the cold air actually mimics like that the person is having allergies.
Okay, doctor. I have a question from whatever you said, doctor. When it leads to dryness in throat and all of that, will having hot water on a very regular basis help with it? Or is it okay if we just stick on to how our normal routine works?
Yes. So definitely, if we sip onto some soothing or warm water or hot water, this will definitely help us, and we can keep a humidifier in the room. That will also help us.
Okay, doctor, that's great. My next question for you, doctor, is can sleeping in AC increase these symptoms relating to allergy?
Yes. So it is more or less a similar question like the previous one. So all the things that goes with the cold air from the AC, that reduces the body immunity, that makes the airway sensitive, that dries out the nasal passages in the throat. Apart from that, the only problem with ACs is that they recirculates the air. So the number of allergens that actually increases in the room. And if we are not routinely cleaning the AC filters, we are not replacing the AC filters, we are not maintaining a temperature of between 25 to 27 degrees Celsius, we are not ensuring adequate ventilation in the room, these things may increase. And allergies may actually increase with the excessive use of ACs.
Okay, doctor, that's actually a very good way to dealing with it. So, can allergies affect our breathing and sleep on a very regular basis, doctor?
Yes, yes, yes. See, it's a vicious cycle. So if we are not able to sleep in a quality manner, then this leads to a vicious cycle of that the body's immunity is disturbed, and then this leads to worsening of the allergies, and then allergies they lead to disturbance of the immune system. So it becomes a cycle. They disturb our circadian rhythms. They lead to the inflammations, the direct nasal congestions, and all the symptoms can be repeatedly there.
Okay, doctor. So, can you also please explain which type of allergies will exactly affect our breathing on a regular basis, doctor?
Okay, so this is a very tricky question. So let us take it in two parts. See, if we are talking only about the respiratory allergies, like the nasal allergies, the chest allergies, so the chest allergies can be from the very basic, like bronchitis, up to the spectrum of asthma. And the nasal allergies can be from the very basic to runny nose up to the spectrum of actual nasal blockage. That may be because of the congestion part, that may be because of the nasal polyps, which are the extremes of the allergies. So they directly leads to the sleep disturbances by the way of obstruction. तो सांस ही नहीं आएगा तो फिर नींद पूरी कैसे होगी. Second, there can be skin allergies, eczemas, which we call. So, eczemas, what happens is because of this eczema condition, the skin allergies, the patient usually feel itchy all the night. So, they are not able to have a sound sleep, and it is indirectly affecting the sleep quality.
True, very, very true, doctor, about it. And we have a question coming from Simran in today's session, doctor. So, her question is: are children more affected by allergies during sleep?
See, it is not like only the children are affected. Yes, but the thing is that in children there is a mass called as adenoids, which is behind the nose. So there is already a little compromisation of the nasal airway. So if there is an added inflammation because of these allergies, then the children are more affected. है ना?
Yes, yes, doctor. Totally makes sense about it. Just give me a moment, doctor. I'm trying to find. Yes, doctor. We have a question from Poonam. Does avoiding pets in the bedroom improve our breathing?
See, so So this avoidance of pets, this is not very directly related. Why? Because if the person is having allergies related to pets, then yes. But in general, if we are talking that only avoidance of pets is good, no. See, there is now a different hypothesis about this allergy that is called as hygiene hypothesis. So, if we are exposed to such things means exposed to animals, exposed to that dirty environment which we were children we used to be exposed to, and we are not living in an over sanitized thing, over sanitized house, then we are exposed to a microbiome. We are exposed to so many microorganisms which actually help in preventing allergies. So, in a way, this exposure to pets is good, but if you are allergic to a pet, yes, then it has to be avoided. But there is no general consensus like they have to be avoided and the allergies will be gone. No.
Definitely. Definitely, doctor. I can see that stemming from the root cause of how certain pets would be allergic to few and certain would not be allergic to few too.
Yes.
So it's very important that we give attention to whatever suits our thing. It's very rightly said by you, doctor. So the next question that we have for today is, what time of the day are allergies worse, and is there any particular reason that it happens so?
So see, to find out what time of the day the allergies are worse is we have to get to the root cause, that what is that specific reason to which you are allergic. So it can range from the very common thing, that is the house dust mite. So house dust mite allergies are the commonest allergies. So what are house dust mite? They are basically the insects. They are the small tiny insects which cannot be seen through naked eyes. They are found everywhere. They are found in the carpets, they are found in the beddings, curtains, soft toys, upholstered furniture. They are found everywhere in the room. So if a person is allergic to such things, then he will be having allergies maximum when he is in the room. Mainly, so that goes like mainly at the night time and the early mornings. Okay. So if a person is not allergic to house dust mite, then if he is allergic to pollens, then probably the timing of allergies will be from somewhere between mid afternoon to the late evenings, like 2 to 6 p.m. because that is the time when the pollen counts is the highest. So that depends the day, the timing of the day. That depends on the kind of allergy the person is suffering from.
True. Very true, doctor. So, what are the common allergens that mostly disrupt sleep schedule, and how does these allergies exactly affect our breathing on the long run, doctor?
Okay. So as I have already told, the most common allergen is the dust mite. The full name is house dust mite. So it is a tiny insect which is propagating only in the houses. It is white as dust because they are very tiny. They cannot be seen through naked eyes. They are just like dust. And mites because they are actually the insects. So that is like the theory goes like house dust mite. That is the commonest allergen. The second most common allergen is the pollens. And out of the pollens, the commonest is the parthenium, what we call as congress grass, or we call it as gajar gavat in Hindi. So that is the second commonest allergen. Then the third commonest allergen is like cockroaches. Cockroach. So this is also tricky. So cockroach as such, you are seeing a cockroach and you are being allergic? No, it's not like that. So basically, if we are killing a cockroach by a broom, so we are what we are doing is uska jo dust banega after that brooming off. That is the thing which is allergic. So if we are killing that cockroach with a hit spray, probably even if a person is allergic to cockroach, he will not experience the exact symptoms. So that is
Okay.
the third commonest thing. And later of the lot is that funguses are there, some other pets are there. So those are the things.
Definitely, doctor. So, would you tell there is any age correlation in specific between whatever allergies that you had mentioned now? Like you had actually mentioned a list of 4 to 5 allergies. That's usually common in patients, right? So, is it very age specific, or is it like everyone or anyone can get used to these allergens easily?
If we talk about age now, probably the skin allergies, the eczema thing, they are little more common in the younger age groups. But if you talk about the respiratory allergies, then every person can get the allergies. It's not like that the children are more prone for developing it or the older ones are more prone. And of course the environment also plays a role, like whenever the people come to us, they usually say, डॉक्टर साहब मुझे धुएं से एलर्जी है, मुझे बाहर जाते हैं तो पोल्यूशन से एलर्जी है. Okay, so the correct way to explain it to the patient is that there is nothing called as धुएं से allergy, but yes, the actual diesel particles, they increases the allergenicity. देर इज नथिंग कॉल्ड एज डस्ट, मतलब धूल, सादी धूल से यानी कि सैंड पार्टिकल से एलर्जी, बिकॉज दे कॉजेज इरिटेशन. एंड इरिटेशन तो सबको होना ही चाहिए. अगर इरिटेशन नहीं होगा, छींके नहीं आएंगी, तो धूल फेफड़े में जम जाएगी. सो दैट इज अ प्रोटेक्टिव रिफ्लेक्स. सो पीपल यूजुअली कंफ्यूज इट with the environment, they usually confuse it with the age. So it is not like that, that some people are more prone. It is the exact allergen, and the allergies can develop in any age group.
Definitely, doctor. That's exactly right. And do you think the effect of the allergies on sleep and breathing can be reduced over a period of time by the people who are actually affected by this, doctor?
Yes. So if we have to deal with it, then probably we can take some common measures also. Like I have told that the commonest thing is the house dust mite. So if we are taking some measures like cleaning the our beddings and all on a routine basis, we can use vacuum cleaners. The beds and pillows which cannot be cleaned should be at least sunbathed for at least 3 hours, 1 to 2 times a week. The clothes should be washed in a higher temperature, like more than 55 degrees Celsius, that kills this house dust mite. And we can use some dehumidifiers because humidity increases this thing. The less use of ACs, the ventilation has to be proper, the less use of carpets, upholstered furnitures, and soft toys should be removed. Unnecessary items should be removed because they are the source of such house dust mites or the allergens. So those
Definitely.
are the things probably a common man can take as a precaution so that the allergies can be reduced to some extent. But yes, when it comes to specific therapy, then probably the allergy skin prick test is the ideal thing to be done. So what is an allergy skin prick test? So allergy skin prick test is something that we put the allergens on the skin of the forearm and we do a very gentle prick, just like a mosquito bites. So even if mosquito bites, sometimes there is a wheal and flare and sometimes there is nothing. So if when we are doing the testing and we are seeing that wheel and flare, means that person is allergic to that thing. And then comes the actual treatment part. That is the either the avoidance, but like we have discussed for house dust mite only, it is very difficult to do all these measures. And even if we do, we can do it in a one room, probably in your house. But when you travel to a different house, when you travel to your office, when you go to a friend's place, so these are some things which are almost next to impossible to avoid. Then we can treat them by the way of immunotherapy. So what is immunotherapy? We give the same allergen in less concentration to the person to be kept under the tongue sublingually twice a week so that the person's body system, his body accepts that allergen. So that is how probably we can treat the allergies, and that is the only way.
Wonderfully explained, doctor. Thank you so much for explaining it in a very brief way. We have a question coming from Adi Jain, doctor. Is a warm shower before bed helpful for dealing with allergies?
I guess this is a pure myth. So warm shower is not going to help because it has no role as for the actual allergy part. What we usually correlate is like the warm things, as you have told, that sipping on a hot tea or something probably soothes us. So warm shower probably soothes us. It relieves our nasal congestion probably for a bit, but it is definitely not a treatment part. No.
Definitely, doctor. So we have another question from Syed Rehan, doctor. Does keeping windows closed help during pollen seasons, especially?
Yes. So, Sayed, but the problem with this question is that are you sure that you are allergic to pollens? If you are very sure that you are allergic to pollens, then yes, keeping the windows closed will help you. But if you are allergic to house dust mites, then the house dust mite concentration will increase. So that may not be a preventive thing. So
Yes,
I will put it like this: ki, to get to this conclusion of being allergic to pollens or house dust mite, you should get that allergy skin prick testing done. That is the gold standard test to first identify the reason behind it. We should now the era is we should not ignore such things, the allergies, because yes, we can actually treat the allergies and we can uh, go beyond these general notions of keeping the windows closed, getting adequate ventilation, what is good for you or not. We have to get to the root cause first.
definitely, doctor. We have another question coming for you, doctor. That is, what factors can be controlled to reduce the effect of allergies on sleep and breathing on a regular basis?
Okay, so when we talk on a regular basis, then probably, like I told you, that the room should be adequately ventilated, and we can use the filters. We can replace the AC filters or regular cleaning of the AC filters. We can maintain the temperature of around 25 to 7 degrees Celsius, not too cold, not too hot. And if especially if it is a too winter season, then probably we can use this humidifiers also, because they help in preventing this dryness part. They help in preventing this allergies and immunity part also.
Definitely, doctor. So I have another question for you, doctor. Is that are allergies genetic or can they develop later in life at any point of time?
Okay. So this is a very good question, because too many of the patients, they come to us and they says that मुझे भी है, मेरे father को भी है और उनके father को भी था. So that is why my child will also develop. So there is a condition called as atopy. So atopy is a genetic condition which one generation can pass it to the other generation. But what is atopy? Atopy is the tendency to develop allergies. It is not an allergy. It is a tendency to develop allergies. So allergy is purely an acquired phenomenon. So you cannot pass allergies to the next generation. You can
Definitely.
pass atopy, the tendency to develop allergies, but allergies per se is purely an acquired thing.
Yes, definitely, doctor. So while coming to this, can stress or anxiety worsen the allergy symptoms in some people, or is it just normal and just a part of daily life?
Stress and anxiety can worsen the things. Why? Because stress and anxiety has to do a lot with the hormonal changes in the body. So whenever those hormones are released, then probably the nasal stuffiness or congestion increases, and then the person will feel like he is having allergies.
Definitely.
So that goes like, even if you are too much in the excitement, then also you may feel the same thing.
Yes, doctor, definitely. So, is allergy the same condition as cold or sinus infections, or how can we differentiate if these two are completely different, doctor?
Okay. So allergies are totally different from the nasal infection or sinusitis thing. Why? Because they are the infective processes, and allergies is purely an inflammatory process. There is no role of any antibiotic in the allergies. The allergies have to be dealt only and only with the help of decongestants.
Definitely. Then, doctor, while sleeping, we usually spoke about how we will have a congested sleep or there'll be a nasal block, usually, right? So, does mouth breathing due to allergies affect our sleep quality in general?
Yes, yes, yes. So if the person is doing only a mouth breathing, then probably the throat will dry up, and the dry throat is more prone for infections. He may start having this LPR things. The acidity increases. The person feel like disturbed sleep. Why? Because every time his mouth is dried up, he feels like drinking water. The sleep is disturbed. He has to wake up 3 4 times. So of course, it will definitely affect the quality of sleep.
Quality of sleep. So, doctor, when coming to snoring and all of these issues, can allergies actually cause snoring, or will it worsen it, or is it just a part of two different things just going on?
Okay, so allergies per se, only allergy cannot cause snoring, but yes, if a person is having snoring, then they can worsen it, because they also play a role in decreasing the nasal passages, the basically the passage for the airway. So the
Definitely.
per se they don't cause snoring, but yes, if there is snoring, they will increase the snoring.
Okay. So there's another question, doctor. Coming to seasonal and weather related questions relating to allergy. Are urban allergies different from how it is in rural allergies, or is it the same?
Okay. So urban allergies are almost the same, but the thing is that they are more in the urban world allergies. Why? Because I have already told you about this hygiene hypothesis.
Yes.
The more protective environment we provide to our children, they having more tendency to develop allergies. So it is because they are not being exposed to the microorganisms. They are not being exposed to the dirt, which we call them. They are not allowed to play in the mud. They are not allowed to touch the pets when they are too young. So those are the things which may actually increase the allergies. And the only thing with urbanization, if you want to say that probably the pollution, not the direct pollution, but the diesel particles, what they do is they increases the allergenicity of the same allergen. So they do increase the allergies.
Okay. So when will a patient know whether they should consult an ENT or a pulmonologist? When will they exactly know which surgeon to visit, doctor?
Okay. So what I will say is that probably they should meet an allergy specialist. They are the better persons. So you will find some allergy specialists in both the specialities, be it the ENT and be it the chest. But the ENT persons, they are more taking up the allergies because the entry point for the airway is the nose only. So if you probably treat the allergies at the right at its entry, then you may get the better result.
Definitely, doctor. So, when coming to the treatment and prevention in relation to this, doctor, are antihistamines safe for a long term use?
Okay, so with the continuous R&D, the many newer antihistamines are coming up, and of course they are quite safe also. But again, I will say the same thing that probably if you are being allergic to a thing, then only using antihistamines is not going to serve the purpose, because then you will end up using it for years, maybe 10 years, 20 years, or maybe lifelong, because they are only going to give you the symptomatic relief. Ultimately, you have to meet an allergy specialist. You have to get that allergy testing done. You have to know what is that allergen, and then the treatment is probably only the avoidance of the thing, and if not avoidance, then immunotherapy. That is the stable and a long-term solution.
Definitely, doctor. We have a question from Nitin Bansud, doctor. So, morning time running nose and chink is happening regularly. What precautions should be taken? Is his question.
Uh, can you repeat the question? I didn't got it.
Definitely, doctor. Morning time running nose and chink is happening on a regular basis. What
Mhm.
precautions can be taken?
Okay. So the morning time running nose and itching, they are probably the symptoms of the house dust mite allergies, because as I have already told, they are more in the morning. So as a general part of precaution, I will say that they can go for regular steaming. Steam will definitely help in clear the nasal passages. And a better way than that is probably the neti wash. So they can do a gel neti wash. So what happens is, if you are doing a gel neti, then that clears the nasal passages. They actually wash out that allergens and help in improvement of the symptoms. And you will be
Def-
surprised to know that itching in the eyes is also related to the runny nose. So if you are clearing your nasal passages, if you are treating nasal allergies, then probably eye itching will also be gone along with it.
Definitely, doctor. So, can keeping indoor plants worsen allergies at night?
Okay, so this is a very specific questions. So there are certain plants which are actually helpful, and there are certain plants which are having the pollens, like what we call as they are being aeropollinated. So the pollens are there in the air, and then those are the ones which should be avoided inside the room, because then you may have the chances of becoming allergic to pollens and increases the symptoms.
Definitely, doctor. So, there's another question from the team, doctor. Does sun drying pillows and mattresses reduce the dust mites that we've been receiving?
Yes, 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 very true. So this is a fact that sun drying the pillows and mattresses definitely reduces dust mites, but it has to be done on a very regular basis. If you are sun drying them in a month, then no, that is of no use. But if you are sun drying them probably once or twice a week, then yes, they will certainly help you.
Definitely, doctor. So, is there any specific link between allergies and sleep apnea, doctor?
Okay, so sleep apnea is something which is the extreme form of snoring, you can call it. The person is not able to breathe during the sleep, probably for a few seconds. So he may feel like he has to wake up. So allergies doesn't directly lead to that sleep apnea thing. That is the extreme form. But yes, if the person is having sleep apnea, and he then allergies may increase it a little. Like allergies may increase the snoring a little, but they don't cause snoring. They may increase that phenomena. Similarly, they directly don't lead to sleep apnea. But yes, if the person is having sleep apnea, they will increase that symptoms.
Definitely, doctor. So, how often should bedding be cleaned? Is one such question that you had answered, doctor. But can diet influence allergy related inflammation for normal patients?
So see, now the diet is coming up. So now the treatment of allergies is not only about the medicines and immunotherapy. Now it is a holistic approach. Yes, so diet definitely plays a very important role. Some people say that reducing the animal diet, that may have an effect of reducing the inflammation. So that is still under studies, but I don't want to have a concrete this thing over that. But diet definitely helps a role.
Definitely, doctor. So, my next question for you is, doctor, what are the warning signs that allergies are affecting breathing seriously on a regular basis?
Okay, so person has to introspect himself or herself, that if the patient is the person is having sneezing on a regular basis, and if it is not like a normal sneeze, they are 5 to 6 at a time. If the person is feeling that choking nose every time, person is having cough, and cough is like whenever he has to talk to someone, he has to deliver a speech, he is not comfortable talking to their clients. So those are the signs, the subtle signs which the person has to pick up, and that is the time that he or she should be evaluated.
Definitely, definitely, doctor. Do you have some message that the viewers throughout the session they've been with us, they've known what allergens are, they know how it affects their sleep schedule, and all of that on a regular basis, doctor. So while we come to the end of this session, would you like to give a general advice that all of us, irrelevant of the age groups we fall in, irrelevant of the categories we fall in, what exactly are the precautions or care, preventive care that every single person here should, take care and be regular of, doctor?
Okay, so the general message to the all the public should be that they should be taking care of the mattresses. They should be taking care of the cleaning of the rooms. They can do the washing of the beddings at a temperature of more than 55 degrees Celsius. They should keep their houses well ventilated. It should not be closed ones. And then probably a jal niti or the simple breathing exercise is what we call as pranayam. So that is of use. So pranayam helps. So they can go with these things. They will definitely help them. But at the same time, I must say that we should not ignore those subtle signs that only सर्दी ही तो है क्या होता है दिखा देंगे बाद में जाएंगे कल जाएंगे परसों जाएंगे डॉक्टर को. So they should not ignore those things because otherwise allergies may precipitate to bigger things like bronchitis, bronchial asthma, and then probably we don't have anything to offer but only to keep them under control.
Definitely, definitely, Doctor. Thank you so much, Dr. Gaurav Agarwal, for sharing such valuable insights with us today. This session has definitely helped our viewers understand how allergies can silently affect sleep, breathing, and why timely treatment is very important for everyone. We truly appreciate your time and expert guidance, and we look forward to having you with us definitely again in the future upcoming sessions. And thank you, all our viewers, for joining us today. Stay connected with the Resonance Show and don't forget to like, share, and subscribe to our YouTube channel. This program is brought to you by the makers of Bilaset M, Worsen, and OPOX CV200. Thank you so much. This is Ankur Shreyavashni signing off today. Thank you,
Thank you.
Doctor.